I'm not going to keep my mouth hush for a paycheck. As far as a patient advocate, you have healthcare workers that are afraid to report these things. And when I say that I am the healthcare worker that treat those family members, I'm not going to keep my mouth hush for a paycheck.
Yeah.
I am going to treat the family member as if they're mine, no matter what, because I work for God. That's who I work for, no matter what setting I'm in.
Welcome back, everybody. Another episode of Healthcare Stories with Healthcare Henry. Today we got Amanda Hall. Welcome, welcome, welcome.
Thank you for having me. How are you?
I'm good. Super excited for this because this is a story of true patient advocate, like what that looks like. I think a lot of people think they know, but I think your story, which we'll get to, I don't want to give a spoiler, but just a snippet, someone who was really willing to put their job on the line to help the community. And I think for one, that needs to be applauded. First off, I really believe that. And I think that it takes a lot of strength, resilience, and just something that we really want to get into. So thank you for taking the time to come talk to us today. So, and I won't waste a lot of time. I really want to get into this one because I'm super excited. So give us a little bit of background about you, Amanda. Where are you from? Where do you come from? What kind of family was it like? What was that like for you, your upbringing?
I am from the Dallas, Texas area. Grew up in the country, a small town called Corsicana.
Say that again?
Corsicana, Texas.
Okay.
Country, okay. It's the rural area. Dallas, Texas, if you know, you probably don't know what Corsicana is, but currently living in Dallas, Texas, but I grew up in the country part. Dallas, but I currently live in Dallas, Texas.
Okay. And what was your family dynamic like? What made you kind of grow up and decide you wanted to go into be an occupational therapist assistant?
My parents, my dad was a Dallas police officer. My parents are still together. They're married. So I came from a huge family, loving family. I'm an only child. Just come from a big family. Parents of nurturing, loving. My great aunt made me want to be an occupational therapist assistant. My first major was veterinary science, but I had a great aunt that her birthday was the same as mine. And when she became ill, when we would go visit, March 26th, I'm an Aries.
Okay. All right. All right. I got you.
So when I would go visit her, it was my favorite aunt. She was a lot way older. And I would just want to go to my aunt's house and I would just care for her. My dad would just drop me off and she had me doing everything and I would just care for her. You know, I was that child that wants to be around my aunt and she took ill and she left me power of attorney and I made sure I took care of her. I just had that nurturing, I guess maybe coming from the country and growing up in the country. And just when she took ill and sick, when she was at the hospital, it was just disciplinary crew that came in and they happened to be occupational therapists. And I was just, watching everything, curious, asking questions as a young child and told me what they were. And I just loved what they were doing. They were able, she was mean to everybody, but those occupational therapists was able to get her moving and grooving. And so that's what planted the seed. And I was wanting to be an occupational therapist.
Well, you say that, but it sounds like you originally wanted to be a veterinarian.
Yes.
Okay.
And it changed once I started doing my research on how long, I had to go and had to build your practice. And I was like, I'm going to lean this way.
Yeah. And that's a lot. Yeah. It's a lot. But you love animals, obviously, because what I've gathered is that your social media blew up from horses. Are you familiar? You know horses? Is that your thing? What's up with that?
Yeah, I love all animals, but I have a stubborn horse, man. The only one that we couldn't get to break, and he is so moody, and we fight. And so it just so happens he's the one that got my IG popping. I was out there trying to feed him. He's just so mean to me, and I love him. And he tries to bite me, y'all. He tries to bite me, and
really?
he tries to bite me. I call
How long have you had it?
like 15 years. Well, probably longer. I'm gonna say 18 years. I've had him for 18 years. He's an old horse. And I go out there and brush him and rub him and feed him and walk. I can walk him. He just tries to bite me. I think he be laughing on the inside. I love him. He loves me. But he'll try to bite me.
That's super interesting because a lot of times I know we talk about as caregivers caring for patients, and I kind of will tie that into caring for patients. And a lot of times, even us being the healthcare workers, having to be there and fight through, if you will, them not wanting us around, them being stubborn, them kind of saying, I don't need your help today. But we know like they need our help today more than ever, right? I wonder if some of that translated and that's kind of helps you in your healthcare journey and wanting to be in the occupational therapist assistant world.
Yes, and it is. And you actually, now that I think about it, the mean patients, those were my favorite ones. All the ones that other disciplines be like, I'm not going in there, she mean. I would go up in there and I can get them to do anything.
Yeah.
Do it for me. And and my great aunt that I say that my favorite, nobody, she would be mean. She would do anything for me. So I have that. I can say that's my gift.
I love that. I love that. You have any kids?
I do. I have a 5-year-old.
Okay.
She's my only one.
Okay.
And, mommy's baby. She's 5. And Miss Addison, she's going to be my only one.
Don't say that. You never know.
I'm too old. I waited till too late.
You are probably 32 years old. You will be fine.
Thank you. Look, you're trying to get me on your hospice team.
I'm just saying. You're never too old. You're never too old. I got a 3-year-old now, and I'm 37, I guess. Yeah, 37.
You still got time. You got time. I'm older than you.
I'm a guy, right? So I always have just a little more time anyway.
Oh, sure.
Yeah, I feel like that has totally changed my level of patience with life in general, but specifically with like being able to be around certain people who would tell me, like, because we're in hospice. So the way people talk to me sometimes is not upset at me, but because they're just grieving what they're about to go through or what they're going through. And so for us, it's probably that and nursing home jobs are probably the top 2 hardest jobs I've ever seen in my life. And particularly with you, I guess my real question for you is because I really want them to understand what it is that you went through and how it is that we as the consumer or the patient advocate, as I am, as you are as well, what can we do to look out for these things? Like, how did your story actually start? Like, what did it look like?
As advocating for the patient?
Advocating for the patient in it was a nursing home in Dallas or in Texas, if you will.
As far as them like getting better or
with your specific story and what you were talking about in terms of what you went to bat for the patient and being a patient advocate, like how did that whole thing start?
Oh, well, for one, let me say anyone's family member that comes through a SNF for me, they become my family. And
What's a SNF?
A SNF is a skilled nursing facility. I apologize. So if your family is coming through a skilled nursing facility that I am working at, that is my mom, that is my grandmother, that is my aunt, and I treat them as such. Yeah. And so when I see things that are going on that I feel like is not right, I'm going to speak up for them. And so I'm going to make sure that I'm going to, if it's whatever their needs that need to be met, showered, they need to be done, I'm going to make sure I speak up for them, And so I will speak up for them. And so clarity, when you say with the story, what do you mean? Like
your story. So I know you have a story. One of the well, you could say them both if you like. You can give us whatever one. You got that many things have happened to you?
Yes.
Really? Give us two.
Okay. So one of them happened. I caught them giving one of my patients the wrong diet plan.
When you say you caught them, right?
Nothing per orally. There wasn't supposed to be, let's say, stroke. Mm-hmm. There wasn't supposed to be giving food or water orally through the mouth.
So NPO.
NPO.
Right.
And so, you try to do things and you try to report, you try to educate. And so you kind of get sometimes chastised about those things. And so things can get caught in their lungs, and you die from those things. And that's kind of what happened. And so I was being wrote up for reporting these things, And so I ended up getting terminated for reporting these things. As far as a patient advocate, you have healthcare workers that are afraid to report these things. And when I say that I am the healthcare worker that treat those family members, I'm not going to keep my mouth hush for a paycheck.
Yeah.
I am going to treat the family member as if they're mine, no matter what, because I work for God. That's who I work for, no matter what setting I'm in. Mm-hmm. And I just feel like no matter where I go. Mm-hmm. And so that's what happened to me at one of my locations. And so no matter what healthcare setting I'm in, I let them know that I am a patient's advocate. Now you can choose to hire me or you can choose not to hire me, but we're going to get it understood off top that I am a patient's advocate. Mm-hmm. And that's what I lead in on my interviews. I am a patient's advocate off top. That also lets me know if you choose to hire me, what type of company or organization that you are.
Sure.
Because if you choose not to hire me, then let me know. And that's not the place for me.
Right.
So that's one of my stories.
Hold on. Wait a second. So while you're here, you report that they had a care plan. And, and for those who don't know, you go to a SNF or skilled nursing facility, you upon admission, normally within a day or so, they're going to have a care plan meeting. Mm-hmm. And this care plan meeting goes about everything, how they're going to care for you. And one of those things, the most important things, is the dietitian plan. Mm-hmm. So why would they, in your mind, how did that even happen? Was it an accident, or what is it that they were trying to accomplish? Because I guess I'm a little confused as to were they short staffed and they couldn't puree the food, or what happened?
I would say it was management. It was no proper management. Like I said, it was during a time that it was, and let me say this too. You want to check your nursing to patient capacity. You want to make sure that there's enough nurses, CNAs. That's important to always check.
The ratios.
The ratios. Mm-hmm. When you're going into a nursing facility, you want to always ask that question because you want to make sure because the CNAs are most important to me. Individuals.
Yeah.
All of them are. Let me say, all of us together.
No, I'm with you.
Mm-hmm. But the CNAs are the most vital, and if they are overworked, they can only do so much because they feed, they give showers, they bake, like they're putting on their clothes, they're doing everything there. And honestly, they need to be paid more. I am a advocate for CNAs as well.
I agree.
And as a therapist, I was there to try to help them because I feel like they need more. Mm-hmm. But they can't do it all.
You cannot. Yeah.
They can't do it all, and nurses need to help them more. Let me go on record saying that.
That's a tough one. That's a tough one because it's kind of a domino effect, in my opinion. The doctors put a lot on the nurse practitioner, nurse put a lot on the nurses, and so the CNAs are kind of like the last one standing. So whatever they can do, they don't want to do. They kind of put everything on them. I'm with you 100% though, right? People know I just had 2 parents go through hospice, right, in 2022, and one of the things that really put CNA work into perspective was me trying to give my mother a bath. Like, I just couldn't do it.
It's tough.
I couldn't do it. And it wasn't even just me not wanting to do it, but I could see the look in her eyes where she had lost a piece of pride. And it's like, this CNA thing is different.
Yeah.
It is the most overworked, overlooked, underappreciated part of our industry on the entire planet. So I'm with you. I'm with you on that. Okay. Yeah, I'm with you 100% on that. But I guess, I'm with you.
I'm sorry, go ahead.
Oh,
sorry.
No, go ahead.
This is why it's important, because you can't be on therapy and hospice at the same time. And this is why it's so important that when your family member or your loved one is on therapy, that you have your therapist teaching you and educating your family, your caregiver, how to properly give showers. Like they're running through doing showers. Do not allow your therapist to take your loved one and waste those sessions. You should be getting 3 to 5 sessions, 30, depending on your insurance, 30 to 60-minute sessions each week. 30 to 60 minutes. Huh?
It's in-house, like in a center. Yeah. Okay.
Yes, okay. Now, if it's home health, I think they do 2, if they haven't changed it.
I don't know. I
think they do 2. It should be 2. It still should be the same. But make sure that your home, if it's home health setting, make sure that your therapist is not coming home and just exercising your loved one. Sitting there and exercising, making sure they running you to that tub, making sure they are adapting your loved one's home, and they are showing you, they've got you with that gait belt, and they showing you how to properly, using good body mechanics, transfer your loved one from that bed to that wheelchair or to the, and they are moving your house and making sure that you can get your loved one through the house. Don't do the exercises, because it still is exercise, getting them from their bed and standing them up. That's exercise.
How do you feel about a Hoyer lift? What's your professional opinion?
Inside of the SNF, it needs to be 2 people. And a lot of times, I feel like with a Hoyer, now, if they over a certain size, you don't want to, it needs to be 2 people trying to lift. But with a Hoyer lift, it needs to be 2 people operating that Hoyer lift. You want to do safety, first of all, let me say. It should never be one person operating a Hoyer lift. Never. But this day and time, they understaffed. And never, ever, ever allow one person to operate a Hoyer lift, because I've seen instances where patients are being dropped. Sometimes it's, that, but I just feel like, go ahead.
Why are they understaffed? What is with in your opinion, right? When you say understaffed, because I obviously I'm with you. I believe that vast majority of them are understaffed. But why is it? Is it because we don't have people going to school to be CNAs and therapists anymore? Is it because, like, what is it? Is it the pandemic? What do you think it is right now?
I think it's the systems of Medicare, the amount of money that they're getting paid back from insurance and stuff. Like, they've changed the systems, because I think it was PDM originally. And so the rug levels that they were getting paid, it was from the therapy side. And then they switched it to nursing. And so I feel like they're not getting all that money now back. And so now, like I said, it's been 2.5 years since I've been gone, but they're not getting that money back. And so they're trying to find ways to make a profit now. And so they're cutting back in so many ways to make the facilities or the owners profit. And they're not really focused on clients. They're not really focused on customer service anymore,
So they're doing bare minimum.
They're doing very bare minimum. And so working with less staff, overworking the people that you have is what they're doing now.
So I'm going to give a quick business lesson. And in those who watch anything that I put out, is always, I'm saying, the biggest issue in American healthcare system is the certificate of need. And a certificate of need is a statement, a piece of paper, essentially, that every state pretty much gives out for certain disciplines or different types of healthcare medicine that we can do. The nursing home rehab center across the board is one of the highest, most requested businesses to do, because you cannot get one without a certificate of need. And the reason why I say that's the worst thing that ever happened to the American healthcare system is because if I've got it, they take the assumption that everyone's going to do the right thing. But the reality of it is, these companies used to be owned by people like me and you, people who cared, people who loved people, had empathy. It's not like that anymore. They're owned by large private equity groups, family offices. They've invested hundreds of millions of dollars into these companies. And so when you take away and you input certificate of need, you took away all competition. So number one, I don't have to be the best. because no one can come into my industry. Number two, there's already a shortage. So you have to send them to me no matter what. And number three, no matter how bad I am, you really can't shut me down because you don't even have a replacement. So to your point, it's like, you're right. They bare minimum, the absolute bare minimum. Yeah.
The bare minimum.
The bare minimum. Yep.
I have a question for you. What do you feel about this new, I'm sorry, am I getting off?
No, go ahead.
I'm not supposed to be asking questions. How do you
It's all
feel about
good. I get it. It's good.
I don't know. I'm going to stay in line.
No, go ahead. No, it's fine.
What do you think about like this Trump? How do you feel about this whole, the Medicare, his new bill, this big bill?
The big, beautiful bill?
The big, beautiful bill, and how it's going to affect more so taking away the Medicare. Now, tell me this could be wrong. Like I tried to do a little research on it. And if it's true or not, because like I said, you can't believe everything you see. True. Is he requiring people weekly that if you're anywhere in the ages from 19 to 64, that you have to work 20 hours, at least minimum 20 hours per week in order to receive Medicare? Is that true?
I don't want to get into the specifics, but I'll give you broad picture my thought process. Okay. The people, if you understand healthcare is a business, right? So outside of your mom and pop organizations, everyone else is big business. So if you look at it from that vantage point, if I'm big business, am I going to let somebody, to the best of my ability, come in and affect how much money we can make? Because the moment you start kicking people off of Medicaid, requiring people to go through all this stuff to get on Medicare, and you start slashing my payments, right? I just don't think from a business standpoint, those lobbyists and the people that are who are really entrenched and involved with the business of healthcare, I don't think it's going to work. You would essentially put every hospital out of business.
True.
And here's the thing about hospitals. I've never said this publicly. Hospitals are really just for the most part, they're a huge feeder system. It's a place where you go in, they diagnose you with something, then they send you somewhere else to get fixed. Now, a lot of people look at hospitals being in the red a lot of the time because they are. But the reality of it is we're only looking at the P&L statement of the hospital. The hospital also owns the surgery center. The hospital also owns the urgent care. So now all of these things, you come into the hospital, they find somewhere to put you, they're going to make money somewhere. So no, I don't even see the hospitals going for this. And I don't see it working. I think this is just hoopla for something else to just get everyone so upset. But I don't actually think that any of this is going to work. I don't see it. Yeah, I don't see it.
I agree.
That's just my take on it. But back to you though, because I really want people to understand, because I call myself a patient advocate, right? But I think it's different when someone is a patient advocate and they lost their job fighting for the patient. And I know that was one instance, but towards the end of that, and you going up and telling them, this is wrong, this is wrong, this is wrong, up until you actually losing your job. Like, how did they justify that? Were they just casually writing you up? What happened there?
Oh, they said that I wasn't wearing my mask while eating. They expected me to take a bite of food, eat, and put it back on, and then take another bite of food, and then eat and put it back on. Yeah. That's why I got written up.
Gotcha. Okay. Let's go to a different one because I got the gist of this. This is ridiculous. So give us another instance of when you actually had to step up. And did you lose your job livelihood more than once over this, or was that the only time?
No, the next job that I had, like I said, I went in letting them know. Like, I'm very transparent and honest. I was like, hey.
I love that, by the way.
Yeah, I was like, I lost my last job for this, and I told them, because, they had to do Why was you terminated? I'm a patient's advocate, and I told them, And so when they called and they did the background check, they found out why I was terminated. And they hired me, the next company. And so I was very transparent when they hired me that I wouldn't even be there for long, because I just felt it in me that I just knew that my calling was bigger.
Yeah.
And so I stayed there at the organization until I found this job that I'm currently at.
Where are you now?
I am currently at a nonprofit organization in Dallas, which is not healthcare.
Okay.
Like I said, we serve underserved communities. We work with victims of gun violence.
Oh, wow. So along the same lines, though.
Yeah, helping people,
Helping the underserved. Yeah.
Helping the underserved for my people, for sure. Helping people. I have a heart for serving. I have a servant leader heart for sure. Mm-hmm. I love helping people. For sure, I have identified that. And
it takes, I wish we had more of that. Right. I think we've gotten too far away, but go ahead. Yeah. No, I'm with you.
Sure. Mm-hmm. And I know my calling is that. And they hired me. And so that meant a lot for that company and that organization. And so I just felt myself in a space like praying, like, so they knew, and so they would be like, Amanda is a patient advocate. And so I just would see the same thing. And so with my patients, yes, they were underserved, but I just knew it was nothing more that I could do. They were short staffed, but they could only do wonderful DON. Mm. When I would report something to her, she would get something done immediately, have someone come and help me. I would go change diapers, even though, yeah, I did. I would do it, I didn't mind doing it at all. I would bill it as bed mobility or whatever, training and all that type of stuff, and change the diapers in the process. It's just teamwork. But I just knew, like, is there something more for me? Like, I needed something bigger for me where I need to help people, because I couldn't keep seeing this same type of stuff. My patients wasn't being heard, and just me seeing it to an extent. I'm not going to say my patients weren't being listened to. They kept saying, like, I'm sick. And I hate it, but my patient was like, Amanda, they're not listening to me. Mm-hmm. For instance, my patient was just like, they keep calling me crazy, Amanda. Like, they would tell me the stories. And I would believe, I'm the healthcare that would believe my patients, even though they might say bipolar or whatever it might have on their diagnosis. I would I believe. Yeah. And true enough, my patient, I could tell her skin that she was changing. Even though I would work with her every day, I know how she worked because I work with her every day. So when her stuff started changing, and I could tell something was wrong with her, and they would like move her phone. They would not send her out, because from my understanding, the acute setting, which is the hospital, goal is to get you out of there quicker, because it's off a pay scale. They get paid more money if they can get you out of there and get you well and get you out of there quicker. The rehab, the SNF, which is the nursing facility, its goal is to keep you longer, because if they have to send you back out of there, they won't get paid as much money. And so they wasn't sending the patients out when they were sick. So my one patient, she's crazy, she's bipolar. And I'm like, no, I'm looking at her skin, it's changing a different color. She's not right. She's like, Amanda, just so happened. I'm like, look, you have the right to call 911 and tell them to come and get you. They kept moving her cell phone from her, and I kept putting it next to her, and she ended up calling 911. She called 911 for them to come and get her. They didn't want her to do that. She'd never returned. Just so happened she was sepsis.
She probably would have passed there. Well, not probably.
She was going to. They would not give me an update on her, but I believe she ended up passing. It was just instances like that, as I would do therapy with my patients, I would see their oxygen declining, which I knew it wasn't right. And I would go report it to the nurses. And I hate it, but it would be a battle between therapy and nurses. And the nurses wouldn't go check. Not to make it a battle, and we should be able to stick together, but I would just see what I'm trying to say, the lack of not empathy, but the lack of like concern of like, let me go and see,
Sure. It's a lack of compassion there for sure.
Lack of compassion, this man is resting, he in there if he is having anxiety attack, and my patients are like, I couldn't, basically, long story short, I couldn't see it all. It was happening too often and too frequent for me. And so I had to make a change of career.
So would you say that the patients who had family come consistently get better treatment?
Yeah, for sure. And I would definitely say that you need to be the type of family member to have a camera, which that's legal. You can have those type of cameras if you cannot. I understand we have to work to survive in this world and you can't be there all the time. But purchase a camera to put into your family member room to at least, hey, how you doing, Greenie? How you doing? You know, something to make sure they have their needs and that people are doing what they're supposed to. Because if you don't, they're not checking on people. Or hire someone that can. I don't know. I know it's expensive, but or take care of your family members. Move them home.
I've been preaching that for years, and I think that, you know, I saw a comment on either Instagram or TikTok the other day where someone said to me, in theory, because I said that in theory, they said it makes sense. The problem is, and this is, and I've thought about this before, but it was until he said it, I said, this is a problem. You've got people who've got to go to work. So back in the day, you didn't have to pay $5 for a carton of eggs, right? You did not have a mortgage of $2,500, $3,000 a month. And everything was able to be handled by one person. Nowadays, both people are working.
Yeah.
Right? So who's going to actually stay home and take care of mom and dad and kind of do these things? And I fear, this is off topic, but it's important because I fear for a lot of healthcare jobs, not so much the clinical jobs, a lot of them, but the vast majority of the administrative jobs are going to go out of business because AI has truly transformed the help that we actually need. Mm-hmm. And so how are these people going to stay afloat? How can they actually stay home and care for a loved one and still pay for all their bills? Like, I just don't see it happening. And to me, the only true fix is every senator, every lobbyist who's pro people has to come out and say, we need more healthcare companies because we have an influx of people. And honestly, Medicare, in my opinion, Medicaid as well, would much rather pay nursing home, home health, or hospice than pay that hospital bill.
Yeah.
So I really don't understand it. But nonetheless, if we take them home, how are we going to do that and still have people take care of their basic needs? How do you suggest they do that?
Don't Medicaid, probably more than you do know more than this. Medicaid, don't they have some plans that pay people, family members, to care?
So there's a program, it's called Family Structured Care. It's very difficult to qualify. And once you do qualify, you can't do anything but that. You can't have another job, not even, you can't do anything. And I don't think it pays maybe I don't want to say the exact number, but it's not really enough. And it's a limited amount of hours. It's not unlimited. So it's really not that helpful. The reality of it is, in most cases, you're better off working another job than getting family structured care. But if that's your only alternative, then sure, that's what you have to do.
So why can't we lobby to allow them to make it a full 40-hour job, pay what they're paying CNAs, and you send your CNAs into people's homes and do home health care and pay them full time to be in people's homes?
The one reason I can think of is because you're better off paying a facility who might have one CNA to 11 or 12 or even 8 people and still pay that CNA the $40,000 a year versus paying one CNA $40,000 a year per person that needs help at home. I think from a cost standpoint, I think that would become, we're already running a problem here budget wise. And I think that would really put a strain on. Yeah. I think it's the right thing to do. I'm not disagreeing with that, but I do think it would put a strain on how our budgets specifically for Medicaid, I can speak for Georgia for sure. It would put a strain.
Nurses? Do traveling nurses when they have caseloads or something?
I don't know.
Jesus.
I don't know. Yeah, it's a thing. Yeah,
family members more.
I'm with you. I do think
because they would save more than putting them in a nursing home if they so worried about paying at a nursing home and paying a full staff. Go ahead and pay their family member their $22, $25 an hour to just sit at home, and then that way they don't have to worry about paying this full nursing home bill.
You might be right. I don't know. We have to run the numbers, but you might be right. You might be right. It just, for me, it just sounds, it sounds like that would be a good idea in theory. But for one, we don't have enough CNAs to do that. That's the first thing, or enough family members who would be willing to do it. And then if we did, I just don't know how we would pay. See, the only thing with the nursing home is that the labor ratios, to your point, right? I know, like, for like, I think it's 1-8 or 1-12. I'm not sure what it is exactly, but having one person take care of that many people versus one person take care of one person is a little different. Yeah. But I see what you're saying, because ideally, I think that people should be at home with their loved ones, but it's a whole nother thing. We got people in Atlanta now dying in the hospital every day simply because it just seems like they're afraid of them not making it home or wherever in the ambulance. And so that would become a death to the hospital, which would affect their mortality rate. That's one of the biggest issues I'm seeing here. So if that person was able to go home earlier, right, even with whatever medications that they needed. Now I'm with you. I agree. Finding a way for them to go home would be ideal, but I don't know how to do it.
We got to start brainstorming on stuff like this.
Yeah, we can. And which is my next question for you. Long term, what do you want to do?
I definitely want to keep advocating for the people. I definitely want to own my own business. I see myself doing something as far as advocating management, doing something as far as in urban communities for sure. I have a heart for the geriatric population for sure.
Me too.
I feel like I'm towards the end of it. I know it's the advocating for people, minority group, and geriatric. So I'm like on the cusp of it. Mm-hmm. But I love serving. I'm almost there. Yeah, and as long as I keep connecting and I'm staying in tune, and God keep, planting these little seeds for me to connect with people, I'm getting there. So
what can I do to help?
Keep connecting with me, brother. We're going to keep on. Stay in tune. Stay connected with me. I feel it like it's coming.
I got you. I'll work with you. And one of the things I do, I'll do it for you for free, for like sake, for whatever. Don't worry about it. But when I never wanted to have like a healthcare consulting business. And the reason why I never did it was because I always felt like people underestimate the amount of capital it takes to start one. Forget run one, start one. And so when people go out to these consulting firms and they're like, yeah, give me 25,000, 50,000, but they don't tell them you actually won't be able to build a business here for 10 years. So if it's something I could definitely help people, then I will. But no, I definitely want to help you. I want to figure out how I can like help you kind of you already got you don't seem money centered. And I think that value and wanting to give back to the people is something that I really take seriously. So yeah, if I can help you out.
I appreciate it. We definitely got to stay connected.
For sure. And I appreciate you coming on. And anybody wants to reach out to you, where can they find you?
You can find me in Dallas, Texas on my IG. You can find me at Amanda, that's A.Manda _H.ALL. It's my IG.
All right.
Thank you so much.
I appreciate it
for having me.
Thank you, Amanda. I appreciate you.
You have a blessed day.
All right, you too.
Bye.
Bye.